Patient is a 25-year-old man who complains of constant itching. He notices that he has puffy red light rashes sprouting up from his arms and chest, and his eyes are watery. He is young and active and possesses no other serious medical conditions. His physician diagnosed him with hives and prescribed Clarinex, desloratadine, 5 milligrams daily twice a day.
Hello, how are you?
Hey, doctor.
For Christ's sake, I'm not doctor. Get it right, I'm a nurse.
Whatever, dude. I'm feeling like crap. I have hives all over. I'm itchy. My eyes are watery. I don't feel well.
Do you have any red bumps in your hand?
Yeah, all over.
Itchy, scratchy?
Yeah.
How's it feel?
It feels good.
Okay. What did doctor prescribe you? This is Clarinex.
Okay.
Clarinex is a tricyclic antihistamine, which is an antagonistic to the H1 histamine receptors. It is used to treat and relieve the symptoms of hay fever and hives. Antihistamines work by preventing the effects of a substance called histamine, which is produced by the body. Histamine is usually produced in localized places like wounds. It can cause inflammation after the body launches an immune response. Unlike other histamines, Clarinex is a H1 second generation, and it does not cause any drowsiness, and it does not enter the nervous system.
Yeah, I didn't understand anything you just said.
Okay, so in English, Clarinex alleviates hives, allergy, hay fever, sneezing, itching, cough. Now, but you have to remember there are many adverse effects like irregular heartbeat, trouble urinating, yellowing of your skin, whiting on your eye, dry mouth, headache, and gastrointestinal disturbances. Okay?
Okay, any contraindications or...
For you young man, no. Contradictions include people usually with liver or kidney failure and those with high PKU levels. Just pop one pill twice a day, flush it down with water, and go on with your life. Okay, buddy?
Thank you, doctor.
Nurse. Thank you, Andrew.
God bless you.
Thank you.
Hi, I'm Nurse Golden.
No.
I just talked to Dr. Laurence, your doctor, and I hear you've been having a hard time with your allergies this season. Sneezing.
Yeah, itchy, red, watery eyes.
Go on.
Runny nose.
And how long have you been having that?
It's actually been a couple weeks.
Well, okay. Dr. Laurence has recommended an over-the-counter antihistamine called cetirizine. It's a non-sedating H1 receptor antagonist. Does that make any sense to you?
No, I'm actually more of a visual learner.
Can I show you?
Yes.
Well, when you're having problems with your allergies, it's actually your body producing too much histamine, and that's what's causing all the symptoms that are making you miserable. Histamine comes and binds to these H1 receptors on the outside of your cell. And it's like turning a switch on to your runny nose. So when you take cetirizine, they come and bind to these same receptors. So when histamine comes, they can't bind, and you feel better.
Visually, I'm impressed, but is this going to make me sleepy or knock me out? I have 7 finals to study for, and I can't be doing that.
The good news is cetirizine is non-sedating. It doesn't cross into your the blood-brain barrier. So you're not going to have the same effects of sedation that you've experienced with other antihistamines. But for this reason, you're going to want to avoid alcohol, opioids, and other sedatives.
Oh, okay. So how exactly do I take cetirizine?
First, just let me double check. Do you have any liver or kidney dysfunction?
Not that I know of.
And are you breastfeeding?
Nope.
Okay, good. Cetirizine is not recommended for women that are breastfeeding. And if you've had any liver or kidney dysfunction, I'd want to give you a lower dose. But since that's not the case, you could take 5 to 10 milligrams daily, depending on the severity of your symptoms. And it's up to you whether you want to take that at once or you could do it into 2 doses.
Okay, do I take it with food?
That's not really going to matter.
Are there any side effects I should expect?
A very, very small percentage of people taking cetirizine may experience some drowsiness, dizziness, fatigue, dry mouth, throat inflammation, or nausea. But if you're concerned about it, why don't you just start with a lower dose and see how you tolerate it?
That's a great idea.
Now, be sure to contact Dr. Laurence if your symptoms don't improve in a week, or if you develop a fever. And just be careful operating any crazy machinery.
Okay, that was really, really helpful, and I can't wait to go pick up some cetirizine at my local drugstore.
Look for it under the name Zyrtec.
Good. Hi, Jamie. My name is Nurse Vanessa, and I see that your doctor recommends loratadine.
Yeah, I love hiking, but the last few times I've been hiking, my eyes get so red and itchy and teary, and my nose gets runny. And after the hike, I just noticed my symptoms getting worse. And it's even made me avoid going hiking.
Oh no, we don't want you doing that. Well, it seems as though you may be having an allergic reaction to pollen.
That makes sense. So will this drug make me feel better? I've never heard of it.
Have you heard of Claritin?
Oh yeah. I've seen those goofy commercials on TV.
Well, that's exactly the drug your doctor prescribed for you.
Oh, I see.
Do you know how this drug works?
Nope.
So loratadine is actually an antihistamine. So histamine is a chemical in your body that, when released from certain cells, will give you the symptoms you've been experiencing, such as a runny nose, the itchy eyes. So loratadine will actually bind to the receptors instead of the histamine, preventing the onset of your symptoms.
I actually understood everything you said. Boy, did that physiology from college actually come in handy.
Good! So loratadine is helpful in treating most of your allergic symptoms. It looks like the doctor prescribed 10 milligrams once a day. You should take 1 tablet a day with or without food to treat your symptoms. Do you have any history of liver or kidney dysfunction?
Nope.
Are you pregnant?
Definitely not. No babies for me yet. What does this all have to do with me taking my medicine?
Well, if you have any history of kidney or liver dysfunction or are pregnant, we might want to give you less of the medication or have you take it every other day to prevent any complications from happening.
Oh, I see.
Also, when taking this medication, you may experience headache, dry mouth, and nervousness. Since this drug does not readily cross the blood-brain barrier, it will not make you as drowsy as some of the antihistamine.
There goes all the physiology again, but I'm glad I understood.
However, if you experience any trouble breathing, swelling in the face or throat, tightness in your chest, or uncontrolled movements of your head and neck, you want to contact the doctor immediately.
Oh wow, okay.
Are there any other questions you may have?
No, you answered everything.
Good, now you can go on your lovely hikes again. Nurse!
Hi, how can I help you?
Could you please get me some medicine? My nose is really, really congested. I can barely breathe.
Oh, of course. Okay, so for your nasal congestion, I have for you a 10 milligram tablet of phenylephrine HCl.
Phenylephrine what?
So, have you ever heard of Sudafed PE?
Ah, yes. My boyfriend's used that before, but I personally have always been really skeptical. How can an oral pill cure my nose?
Well, how it works is that phenylephrine HCl is a decongestant. And basically, it's going to bind to receptors in the blood vessels of your nose. And it's going to cause those blood vessels to constrict and the swollen membranes to shrink, allowing all that blockage to just drain out.
Okay, that sounds great and all, but will this work right away? Can I get one of those nasal spray things? I heard those work really well.
Well, the oral tablets are going to take some time, but it'll relieve you for a longer period of time than, let's say, nasal sprays, which are fast-acting, but they don't work nearly as long and also can make your congestion even worse over time.
Oh, okay, I got it. So, I remember the last time my boyfriend took Sudafed PE, he was really irritable, he was anxious, and he also had trouble sleeping. Was that just a coincidence, or are those actual side effects I can expect?
You're right. Those are side effects of phenylephrine HCl. In addition, it can also affect the rest of your cardiovascular system in the same way it does your nose by constricting all those blood vessels. That's why if you have hypertension or heart dysrhythmias, you're not going to want to take that. Also, this drug will only help your stuffiness, and it will reduce your sneezing or your itching.
Oh, okay, great. But can I just have my phenylephrine now? I'd like to be able to breathe through my nose again.
Sure, here you go.
Hello.
Hi.
I'm Juan. I'll be your nurse.
Hi.
How are you doing?
Good. Well, I'm here today because the doctor prescribed me some asthma medication.
Okay. Which one?
It's called fluticasone propionate.
Okay. Fluticasone propionate. That's a synthetic glucocorticoid that's almost identical to the chemical produced by your adrenal glands. And how it'll help your asthma is that it'll suppress inflammatory responses in your lungs. In other words, it'll keep white blood cells from accumulating in your lungs, and it'll prevent them from secreting chemicals that cause the inflammatory response. It'll keep your airways open by preventing them, preventing swelling and accumulation of the white blood cells in your lungs when you're having asthmatic attacks. In other words, it'll prevent asthmatic attacks. Does that make sense?
Yeah, okay, so the next time I'm having an asthma attack, I can take this.
No. That's the primary contraindication. This is a preventive measure. It'll keep you from having bronchospasms. But in a situation where you're actually having an emergency asthmatic attack, you want to take an immediate bronchodilator such as albuterol or whatever your primary provider has prescribed. That will immediately open your airways. But this drug is meant to keep asthmatic attacks from occurring. Does that make sense?
Yeah.
So don't use this in emergency situations.
Okay, so what about any other side effects?
Be sure to wash your throat and your mouth after you take the medicine, because it's a steroid, and steroids tend to cause fungal infections if you don't wash them off. So be sure to wash your mouth after every use. Use it twice a day, one inhalation at a time. So say once in the morning, one inhalation, and once again at night. Wash your mouth after every use. Other common side effects are sore throat, coughing, sinusitis, upper respiratory infections. But those are mainly the most common side effects. Yeah, so any other questions?
Nope, that's all.
All right.
Thank you.
Take care.
Thank you.